session of our scientific forum, Immunize Talk. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives for one of the kindest platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating the public about the vaccination preventable disease and the importance of timely vaccination. This session features leading experts from across country who share their valuable insights on the key health topics, admiring the rise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. K. Rammohan with us to share their expert perspective on hepatitis A vaccine and public health. I shall be sharing about today's speaker in a short while. For the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. Indian Immunologicals Limited was established in 1982 by National Dairy Development Board as one of the unit and is later incorporated as the company in 1999. Indian Human Biological Institute was founded in 1998 when the government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out unsafe nerve tissue vaccine. Our first manufacturing facility was set up in Uti. The facility is one of its kind in India and rolled out the country's first varicose culture rabies vaccine in the year of 2000. Today, we are a leader in anti-rabies vaccine segment, which presence in across 60 countries. HBI has launched several other vaccines become the major player in human vaccine segment. SBI has been the key supplier and preventable disease to the government of India under its universal immunization program. In yet other milestones, HBI introduced Hevisure in 2024, India's first indigenous developed hepatitis A vaccine, aimed to providing the protection for the both children and adults. With this mission of the saving global healthcare by spreading the One Health initiative and the mission to innovate, produce, market quality healthcare products and service to improve and extend lives. We committed to providing affordable, high quality products through continuous technical innovations to meet our consumer needs. As a market leader, we have taken a significant step towards reducing the plastic burden by 160 tons per annum through introducing eco-friendly packaging, our flagship brand Avera. As part of our corporate social responsibility initiatives, we have adopted schools where IIL provide infrastructure support and basic facilities, including assistance with the midday meal program in association with NDDB. Through the gift milk program, hundreds of school-going children benefit in the dairy milk nutrition. We have also donated an oxygen generated plant to Telangana Institute of Medical Science and Research. There are just a few highlights about Indian Immunologicals Limited. For more information, please visit our website www.indieimmune.com. Immunize with Pride is one of our unique initiatives which emphasizes the vaccination not protects the individuals but also strengthens the community immunity. Welcome to today's episode Immunization Talk. This session is dedicated to highly significant topic hepatitis A vaccine and public health. It's my privilege to introduce the speaker, a leading pediatrician, Dr. K. Rammohan. It's my pleasure to welcome Dr. K. Rammohan, an experienced pediatric intensive with MBBS, DNB, and IDCCM qualification. He is the director of SR Hospital, Tirupati, and consultant at Mother Hospital, Tirupati. Dr. Rammohan completed his MBBS from Kurnool Medical College, DNB from Hyderabad, and specialized in pediatric critical care at Apollo Hospital, Chennai. With 7 years of experience, his key interests including the mechanical ventilation and the pediatric emergencies. We are honored to have Dr. K. Rammohan with us today to share his expertise and insight insights. Welcome, doctor. Welcome, doctor.
Hi everyone. Thank you for introducing me to the team.
Thank you so much, doctor. We are privileged to you on our platform today. So, doctor, as today's topic is the hepatitis A vaccination and public health. To set up the public health contest, doctor, in India today, from a public health perspective, why is the hepatitis A still a concern in India, doctor?
Yes, we all of you know hepatitis A is a burden nowadays. Despite of proper sanitation, it is spreading in the community due to unhygiene, improper handling of food, improper handling of water, and even asymptomatic carriers in crowded places they are spreading. So still it is a burden in the community and everyone has a role to prevent it.
Absolutely, doctor. Doctor, looking beyond just one child, how does hepatitis A affect in wider community?
Yes. See, hepatitis A, we know it will spread through the close contact. That means fecal-oral route. So, in wider community, so like in schools or in eatery places or workplaces, so through the close contact, it will spread and it affects the wider community.
Okay, so is that mean, doctor, those children are already in the baby care center or daycare center? Is it affect for them also?
Yes, obviously. So, even children's infants, especially, they will spread through the feces and without any symptoms. So, there is more chances for the spread in daycare centers also.
Okay, doctor. And doctor, there is a common belief that sanitization only is responsible for the hepatitis A transmission. So, is it true, doctor?
No, obviously sanitation will help. Not only sanitation, so even through asymptomatic carriers, even food handling methods, contaminated water, those also plays a major role. So not only sanitation, other methods also will play a major role in spreading the hepatitis C.
Okay, so if any person is very sanitized and they regularly clean their surface and all the things, so after that also there is a risk for hepatitis A, doctor.
Yes, obviously, see, if he is eating food, he will wash his hands. But the poor cooks, if he is asymptomatic carrier, and through that also it will spread, or through contaminated water also it will spread. So not only his sanitation is important, but the other surrounding people's status also is very important.
Absolutely right, doctor. Doctor, in every spades plays and the plays a big role in exposure, like the schools and daycare centers, hotels and public eating places. So how they will helpful for the transmission?
Yeah. See, if, for example, like schools, so there they will share the same shared facilities as well as the food sharing of the food, and there is a overcrowding and close contact. So obviously, through close contact and through the shared facilities and contaminated food, there is a chance for the spread of the hepatitis A.
Okay, doctor. And doctor, so how we can break the chain of hepatitis A transmission?
Yes, obviously we can prevent or we can at least limit the chain of transmission of hepatitis A through the better vaccination. So, vaccination is the main thing. We can limit the viral replication and we can limit the spread of hepatitis A.
So, doctor, still so many parents have concern about this. So, why hepatitis A vaccination is so important nowadays?
Yeah. Early vaccination gives better protection, and generally, as the age goes on, if disease comes, burden will be high as the age increases. And initially, early protection gives better protection, and through that, see, family burden will decrease, and unnecessarily hospital admissions will reduce. And as such, for a particularly individual child, there is no loss of his daily activities, and again straining in the healthcare system. So a lot of public outbreaks so will happen because of hepatitis A. So those reducing the indirectly not only individual money but hospital related straining as well as government burden. So those everything will be comes under control with proper vaccination.
Okay, doctor. So, doctor, in some cases, it's observed that children often show the mild or no symptoms. What role do they play in silently spreading the hepatitis A in family?
Yeah. See, if you observe, generally, whatever knowledge we have, see, before the onset of symptoms, 2 weeks before, and after the onset of symptoms like jaundice, so even it will spread up to 1 week. So, without symptoms, also they can spread the disease. So, for example, one year child is there in the family. So, older persons like 60 years like that is there. So, this 1 year child may not show the symptoms, but he will passes the hepatitis A through his feces and can adult person can get the hepatitis A. So, without symptoms, these persons can spread the hepatitis A. So, proper immunization of the childrens can lead to decreasing of the burden in whole family.
Okay, so doctor, as you mentioned, the currently they can spread to the senior persons also, those who are present in the family.
Yes.
So we can see that this hepatitis A disease severity increase with the age. So why do adolescent and adults develop more severe hepatitis A than younger children?
Yes. See, if you compare the immunity, so when compared to children's, more immune in older children and adults, so they will fight more actually, and because of better immunity, so more disease occur in the older and adults. So lead to more symptoms. So I can say simply, so more immunity, so more symptoms, so leading to community wider spread.
So, doctor, from healthcare system perspective, how does hepatitis A vaccination reduce the burden of on hospital?
Yes, obviously, see, if, for example, in public sector or somewhere schools or in eatery places, so there is a spread and it leads to outbreaks. So we till now we discussed it will spread through the close contact, even through the contaminated water or food. So obviously, it will lead to one place. More number of persons will affect. So that will again there is strain in the healthcare system and strain in the financial burden so to the family also, and unnecessarily wasting the doctor time also. So because of it is easily preventable thing, so the doctors can spend time in other things also by preventing this burden.
Absolutely, doctor. So, doctor, some parents are seeking clarity about this point. What is the recommended age and and the schedule of hepatitis A vaccination in children?
That's a good question. See, hepatitis A vaccination again two types: live vaccine and inactivated vaccine. See, as per IAP schedule, so 12 months onwards we can give. And if inactivated vaccine, two doses, 6 months apart, so we can give 6 months apart. This will provide the lifelong immunity. So once if you give taken like 6 months apart two doses, that will provide the lifelong immunity.
So, I mean, it will be protect the lifelong immunity, doctor.
Yes, yes.
Okay, thank you so much, doctor. And doctor, another question is there from the audience side. When vaccination is delayed, how does that impact the public health outcomes?
Yeah, previously we discussed. So for delay in the vaccination, there is a silent spread of vaccine through from the infants to the older and adults. Number one, and as goes on increasing, there is a chances for the disease severity high. So early vaccination is better, so that so disease burden will reduce and viral spread will reduce and community whatever outbreaks will reduce either in even in families in small setup like families also, the burden will reduce.
So, doctor, uh, does the vaccinating children indirectly protect the adults as well, or they also need to get the vaccination?
Yes. So protecting the children. These are those the we just now we discussed. No. So they are spreading without symptoms also to the older persons. So by
Right.
preventing the that spread, so older persons also will get benefit. So vaccinating at early ages. So whatever recommended by the IAP at 12 months of age is better than delaying the vaccination.
So, doctor, despite of hepatitis A vaccine availability, what are the most common myths preventing the families to accepting the vaccine?
See, according to my knowledge, so awareness basically they don't know the importance of the hepatitis A vaccine, how much burden in the family, how the inside family members are affecting. So, and lack of awareness, number one thing, and not understanding properly. And as a pediatrician, we are also having the major role in explaining to the families so the importance of vaccine and how indirectly it will help for the whole family. So that I think that plays a major role.
Definitely, doctor. So, doctor, if any outbreak increases in any urban area, how does vaccination help to prevent such kind of outbreak?
Yeah. See, if you compare nowadays in urban, so the migration is very high and crowding places and hotels and so whatever the family functions. So more of crowd, overcrowding is there, and same place there is sharing like whatever functions like that. So proper vaccination it will prevent the spread. So from person to person. So through that, even some countries that are already endemic. So whoever comes from there to here, so those people also will spread the hepatitis A. So if already we vaccinated, that will prevent the that outcomes.
Absolutely, doctor. So, doctor, safety is always a priority for parents. So, how safe is the hepatitis A vaccine, and what assurance would you give you to the parents?
Fine. See, any vaccine will generally developed by the our institutes. So after a lot of research, they will come to the public. So a lot of the vaccines are safe. So like hepatitis A, so it's more safe and minimal side effects only. So whatever in our experience, I mean almost 7 years experience, I never seen even minor side effects to any child. So they are more safe confidently I can say, so they can use. And research also saying so only minor side effects like myalgia pains, mild fever, small redness, but those things also I am not seen in my practice.
Great, doctor. So, doctor, as you mentioned that you and the pediatrician, like you, plays a frontline role in prevention. So, how can they contribute to stronger public health through the vaccination, doctor?
Yeah. See, whenever comes family members, see already government introduced see IAP schedule, and it is not a part of national immunization schedule, but still it is a IAP schedule recommended the proper vaccination. So needs lot of persons needs proper awareness and bit of time, taking some time and giving counseling to the families whenever they come to the OP, so that we'll provide more awareness and will recommend them proper vaccination so that family as well as child will get benefit.
Great, doctor. Absolutely. So, doctor, to close this important discussion, so what is your key message to the parents and the public about hepatitis A vaccination?
Yeah. So I can one thing, hepatitis A is safe. Okay. So you can take at 12 months of onwards, and if you are taking inactivated vaccine at 6 months apart, so two doses is recommended. And by getting this vaccination, your child will get benefit not only by vaccinating your child, not only your child but the whole family will get benefit by preventing the spread.
Okay, thank you so much, doctor. Thank you all of being a part of Immunize Talk. We hope today's session was informative and valuable in spreading awareness on hepatitis A vaccine and public health. Our special thanks to Dr. K. Rammohan for sharing this time, expertise, and insights with us today. For those who would like to revisit our program, the video will be available on our official social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe our YouTube channel. Do like, share, and spread the word as many, including your friends, families, and relatives. Until we meet our next live talk, stay healthy, stay aware, and please take good care of yourself.
Thank you.